হ্যালো ভিউয়ার্স, ওয়েলকাম টু মাই ইউটিউব চ্যানেল দ্য ফিউচার নার্স 24। আজকে আমরা মিডওয়াইফারি নার্সিংয়ের অর্থাৎ অবসার গাইনির অবজেক্টিভ নিয়ে পড়ব। সেটা হচ্ছে ফিল ইন দ্য ব্ল্যাঙ্কস। ফার্স্ট কোশ্চেন, গ্রোথ অফ এন্ডোমেট্রিয়াল টিস্যু আউটসাইড দ্য ইউটারাস ইজ কল্ড endometriosis. Endometrium during pregnancy is known as decidua. The process of fusion of the spermatozoa with mature ovum is fertilization. End of childbearing age is called menopause. The lactiferous ducts act as reservoir for milk. Dash is due to excessive administration of high concentration of oxygen therapy in premature baby. Retrolental fibroplasia. The fertilized ovum is implanted and develops outside the normal uterine is known as ectopic pregnancy. The thickened vascular endometrium of the pregnant uterus is known as decidua. The blood-stained mucoid discharge is called bloody show, which indicates starting of labor. The dash suture, sagittal suture, lies between two parietal bones. The lactiferous duct act as reservoir for milk. Pregnancy can be diagnosed by ultrasound as early as 5th to 6th weeks of gestation. Softening and compressibility of the isthmus of uterus during pregnancy is known as Hagar's sign. Occipitofrontal diameter is 11.5 cm. Causative organism of omphalitis হচ্ছে combination of Staphylococcus aureus, Streptococcus, Escherichia coli. The suture between parietal and occipital bone is known as lamboid suture. The drugs of choice for the management of PPH is ergometrin. The fetal heart sound can auscultate after 18 to 20 weeks. The management from the lower border of the symphysis pubis to the sacral promontory is called diagonal conjugate. The decidua act directly under the embedding ovum is known as decidua basalis. Fetal heart sound is one of the positive signs of pregnancy. In atonic uterus, pulling the cord without separation of placenta causes inversion of uterus. Retrolental fibroplasia is due to excessive use of high concentration of oxygen. There are two ova in dash twins dizygotic. The dash suture lies between the two parietal bones, sagittal suture. The operculum is the mucus plug with the cervical canal. The most common drug is dash, which is oxytocin, used for induction of labor. The blood-stained mucoid discharge is called bloody show, which indicates starting of labor. Alteration of the shape of the forecoming head of the fetus during labor is known as molding. Placenta is not expelled out even 30 minutes after birth of the baby is called retained placenta. In polyhydramnious liquor is more common, 2000 ml. Implantation of a fertilized ovum outside the normal uterine cavity is called ectopic pregnancy. The intermediate muscle fibers at the uterus act as living ligature to control bleeding after delivery. তারপর delay return of the reproductive to normal position is subinvolution. IUCD means intrauterine contraceptive device. Fetal heart sound by ultrasound Doppler can be heard in 10 weeks of pregnancy. The cervical plaque present in pregnant uterus is named as operculum. Prolonged labor is set when the combined duration of the first and second stage is more than 18 hours. Part of the fetus which lies in the lower part of uterus is called cervix. Biparietal diameter of the fetal skull is 9.5 cm. Rupture of membrane beyond 28 week of pregnancy but before the onset of labor is called premature rupture of membrane. Thick mucus cervical plug during pregnancy is known as operculum. The process of fusion of the spermatozoa with mature ovum is known as fertilization. Cervix becomes soft and as early as possible at 6th week of pregnancy is known as Goodell's sign. The alteration of the shape of the fetal head during labor through the resistance of birth is molding. Single most drug is management of eclampsia is magnesium sulfate. Suboccipitobregmatic diameter of fetal skull is 9.5 centimeter. After implantation and until 8 weeks, conceptus is known as embryo. Pigmented line from pubis to umbilicus of a pregnant woman is known as linea nigra. During pregnancy, thickened mucus forms a cervical plug called operculum. When chorionic villi invade up to the myometrium is called placenta accreta. At term, normal placenta is 22 centimeter in diameter. Bones of the pelvis are two innominate bones, one sacrum and one coccyx. Thick mucus cervical plug during pregnancy is known as operculum. Biparietal diameter of the fetal skull is 9.5 centimeter. Fetal ultrasound may be audible with fetoscope by the end of 20 week of pregnancy. In polyhydramnios, the amount of liquor amni is more than 2000 ml. External ballotment elicited in pregnancy as early as 20 weeks. Amniotic fluid is formed from maternal and fetal origin. The measurement from the lower border of the symphysis pubis to the sacral promontory is called diagonal conjugate. The deciduous directly under the embedding ovum is known as deciduo basalis. Retrolental fibroplasia is due to excessive use of concentrated of oxygen therapy. During pregnancy, the endometrium is known as decidua. Accessory lobe of the placenta is known as placenta subcenturiata. Majority of ectopic pregnancy occurs in the ampulla of fallopian tube. Atonic uterus pulling the cord without separation of placenta causes inversion of uterus. Polyhydramnios is defined as a state where liquor amni exceeds 2000 ml. The process of fusion of spermatozoid with mature ovum is called fertilization. Active fetal movement felt by mother at around 18 weeks of pregnancy. Gradual thinning out of cervical canal in labor is called effacement. Embedding of fertilized ovum outside the uterus is known as ectopic pregnancy. When chorionic villi invade up to the myometrium is called placenta accreta. Painless uterine contraction known as Braxton Hicks contraction. Fetal commonest cause of floating head in primary gravida at full term is cephalopelvic disproportion CPD. The commonest cause of breech presentation is prematurity. At about 8 weeks of pregnancy, the dusky hue visible and vaginal wall is known as Chadwick's sign. During pregnancy, daily additional calorie requirement is 300 kilocalorie. Two cell stage is reached approximately 30 hours after fertilization. Endometrium at the base of the blastocyst is known as trophoblast decidua. Creamy substance present on newborn skin is called vernix caseosa. Best method of family welfare planning of mother with 2 children is IUCD. Medical